All right, today we're going to talk about lifelike therapy on Lyme disease. Now, Lyme disease is definitely one of those things that surprises people when they hear that red light therapy can be effective to deal with Lyme disease. Today, I'm just going to read an email that we got from a provider that was using lifelike on a couple of patients with Lyme disease. Okay, so she says, so far I've given a 63-year-old woman with chronic Lyme disease causing chronic fatigue syndrome and fibromyalgia 13 treatments using lifelike and gentle body work. After the first 5 treatments, her C4A markers decreased from the 4,000s, which is very elevated, to about 1,200, which is a clinically acceptable range for inflammation. She's been coming once a week with a break in December and January. At first, she could not exercise at all, and now she feels fine walking a mile on most days. She feels generally a lot better. Her 68-year-old husband, a former Navy SEAL who did 2 tours in Vietnam with some scars to show for it, contracted Lyme disease from her and has had it with intermittent symptoms for about 4 years. He's still an active person. She referred him to me after about 10 treatments because of her improvement. His C4A markers were off the charts in the 8,000s, despite his generally healthy appearance and his ability to work part-time and care for his wife. After 2 treatments of Lifelike and some body work, he showed remarkable physical improvement. His wife said he had so much more color in his complexion, he was standing taller, and he seemed to feel much better. They're both getting their inflammation markers retested soon, but say the results will take a month to come back. I'm looking forward to getting the data, but more than anything, I care about their quality of life. Okay, so again, lifelike therapy is an effective tool to help if you're dealing with Lyme disease. The way you do it is generally put it on the brainstem and down the spine, so halfway down the head and then down the neck and then down the spine, using typically protocol number 9, which is wellness support, which has some antibacterial properties, and then also number 11, which is anti-inflammation. So using those 2 together seems to offer a lot of help for people dealing with Lyme disease. That doesn't mean that just any red light therapy is going to be something that you should try with Lyme disease. It's not going to hurt, but as with everything else with lifelike therapy, we are always pulsing our lights. So the light frequency for number 9 and 11 are using different sets of frequencies, just like everything else. Every other protocol we have is using different frequencies, targeting different cells and issues where the resonant frequency changes. So using lifelike therapy specifically seems to make red light therapy an effective tool in the fight against Lyme disease. As always, if you have any questions about things you can use lifelike for or how to use it, feel free to reach out. And our website is lifeliketherapy.com. Thanks.